Womb wisdom is all about embracing the incredible power of the female body and its connection to life. Did you know that the womb is not just a physical space? It's often seen as a sacred center of creativity and intuition. Pretty cool, right? Here's a fun fact. The womb has a unique ability to store emotional memories. It's like a living library of experiences that can shape our feelings and reactions. So when we talk about healing or nurturing ourselves, we're often referring to this deep connection with our womb. Another fascinating tidbit is that the womb is highly responsive to our environment. Stress, love, and even the energy of those around us can influence its health. This is why practices like meditation, yoga, and self-care are so important. They help create a positive vibe for our womb. And get this, the womb is also linked to our intuition. Many believe that tuning into our womb can enhance our decision-making and creativity. It's like having a built-in compass guiding us through life. Embracing womb wisdom is all about honoring our bodies and getting in touch with our feelings. It's like unlocking this incredible intuitive power within us. How empowering is that, right? It's such a beautiful journey of self-discovery. So let's get to know some womb wisdom you never know. Firstly, your period blood can be bright red to dark brown and anything in between. Normal period blood should not be a bright, strong red like fresh blood. If your period is bright red, this could mean that you have heavy bleeding or that your uterus lining is sloughing off too quickly. This may also mean that your periods are coming too often. A normal cycle should be 21 to 35 days apart. Womb wisdom number 1. Period blood shouldn't have a strong, pungent smell. Period blood shouldn't have a strong, pungent smell. If it does, there may be an underlying condition causing the odor. Some conditions that can cause foul-smelling discharge include bacterial vaginosis, trichomoniasis, and cervical polyps. It's important to note that some birth control methods, such as copper iodes, can make your period smell stronger than usual. If you notice that your period blood has a strong or unpleasant smell, you should see your healthcare provider. They will be able to determine if there is an underlying condition that needs to be treated. So don't suffer in silence. Get the help you need so that you can feel fresh and confident no matter where you are in your cycle. Womb wisdom number 2. Wombs don't leak unless something goes wrong. If you experience any kind of vaginal discharge between your periods, especially if it's yellow, green, or has a foul smell, then please go see your doctor. It could be a sign of infection. It's normal to have some spotting during your period, and that's okay. However, if you're experiencing heavy bleeding or soaking through pads or tampons quickly, you may want to talk to your healthcare provider about using a menstrual cup instead. Menstrual cups are great because they can hold more blood than pads or tampons and they last longer. They can also be more eco-friendly and cost-effective in the long run. Womb wisdom number 3. A late period isn't always a cause for concern. A late period means that your next period is more than a week overdue. Late periods can be caused by a variety of factors, including stress, weight gain or loss, illness, medications, and breastfeeding. Most of the time, a late period is not a cause for concern and your period will eventually return to normal. However, if you're concerned or if your late period continues for more than a few months, you should definitely see your healthcare provider. There could be an underlying issue that needs to be addressed. Also, if you're sexually active and your late period is accompanied by other symptoms such as abdominal pain, fever, or unusual vaginal discharge, you may be pregnant. It's important to rule out pregnancy before starting any treatment for a late period. Womb wisdom number 4. Your flow can tell you about your hormones. If you notice that your flow is unusually heavy or light, it could be a sign that your hormones are out of whack. Your hormones do a lot of important things in your body, like regulating your sleep, metabolism, and growth. When your hormone levels are off balance, it can cause all sorts of problems, including irregular periods. That is why it is important to pay attention to your flow and see your healthcare provider if you notice any changes. They can help you figure out what's going on and get your hormones back in balance. Womb wisdom number 5. Cramps are not normal. Period cramps should not be debilitating. If you're experiencing severe pain, it's important to seek medical attention. There are a variety of treatments available that can help, so don't just suffer in silence. Also, keep in mind that if you're taking certain medications, such as blood thinners, you may be at increased risk of heavy bleeding and should take extra precautions when using menstrual products. Womb wisdom number 6. Endometriosis can cause cysts on your ovaries. Endometriosis happens when uterine lining like tissue grows outside of your uterus. This can cause a lot of pain and discomfort, as well as cysts on your ovaries. These cysts are filled with fluid and can often be felt during an exam. If you think you might have endometriosis, see your healthcare provider. There's no cure for endometriosis, but there are treatments that can help manage the symptoms. Womb wisdom number 7. Polyps are benign growths that can occur in the uterus. Most of the time they don't cause any symptoms, but sometimes they can lead to heavy bleeding or pain. If you think you might have polyps, see your healthcare provider. They can be easily removed with a simple procedure. Womb wisdom number 8. Fibroids are non-cancerous tumors that can develop in the uterus. Some women don't experience any symptoms from fibroids, while others have heavy bleeding or pelvic pain. If you think you might have fibroids, see your healthcare provider. They can offer a variety of treatments to help relieve your symptoms, such as medication or minimally invasive procedures. Womb wisdom number 9. Sexually transmitted infections can cause pelvic inflammatory disease. Pelvic inflammatory disease, or PID, is an infection of the female reproductive organs. It can cause pain, fever, and abnormal vaginal discharge. PID is most commonly caused by sexually transmitted infections, so it's important to practice safe sex and get tested regularly for STIs. If you think you might have PID, see your healthcare provider right away. Untreated, PID can lead to serious complications such as infertility. Womb wisdom number 10. Infertility affects 1 in 6 women. If you're trying to get pregnant but aren't having any luck, you're not alone. There are a variety of things that can cause infertility in women, including PCOS, endometriosis, and fibroids. If you've been trying to conceive for more than a year without success, see your healthcare provider. They can help you identify any potential issues and discuss treatment options. Womb wisdom number 11. Pregnancy doesn't always stick. Unfortunately, many women experience miscarriages, which is the loss of a pregnancy before the baby is able to live outside of the womb. If you experience a miscarriage, know that you're not alone. It's actually one of the most common things to happen in early pregnancy. Most miscarriages are not your fault, and there is usually nothing you could have done to prevent them. If you have a miscarriage, it's important to take care of yourself both physically and emotionally. Allow yourself time to grieve and reach out for support from friends, family, or a therapist. You may also want to see your healthcare provider to discuss your options moving forward, such as trying to conceive again or getting a different form of contraception. Womb wisdom number 12. Breast cancer can affect people with uteruses. Even though breast cancer is more common in people who have gone through menopause, it can still affect those who have uteruses. That's why it's important to be aware of the warning signs and to get screened regularly. If you notice any changes in your breast tissue, such as a lump or a change in size or shape, see your healthcare provider right away. Early detection and treatment are key when it comes to breast cancer. Womb wisdom number 13. Uterine prolapse happens when the uterus slips out of place. This can cause a bulge in the vagina and may make it difficult to stand up. If you think you might have a uterine prolapse, see your healthcare provider. There are a variety of treatments available that can help, including surgery. Womb wisdom number 14. Adenomyosis happens when the uterine lining grows into the muscle of the uterus. This can cause heavy bleeding and pain. If you think you might have adenomyosis, see your healthcare provider. There are a variety of treatments available that can help, including medication and minimally invasive procedures. Womb wisdom number 15. Menopause is a natural process that all people with uteruses go through. It's a time of life when your periods stop and your ovaries stop making estrogen. Menopause typically occurs between the ages of 45 and 55, but it can happen earlier or later. Some women experience symptoms during menopause, such as hot flashes, night sweats, and vaginal dryness. If you're going through menopause and need help managing your symptoms, talk to your healthcare provider. There are a variety of treatments available that can help. We hope you enjoyed learning these womb facts. Did you learn anything new? Let us know in the comments below. And remember, you are not alone. There are millions of people around the world who have uteruses, and we're all in this together. Thanks for watching, and we'll see you next time.